Don's going to be announcing our next speaker, so I'm going to say a couple of things about Don. Don is one of the founders of and managing director of Catalyst IT, a New Zealand-owned and operated open-source company headquartered here in Wellington. I didn't realize that you have hundreds of staff now. And when I first met you, there was like just, you and one other guy. But now, look, Don's a success story. So Don is also the former president of the New Zealand Open Source Society, and you've just stepped down from NZ Rise. Again, amazing. Time passes. I'm not going to say the rest of it because it's you're going to say some things as well, but you're going to be introducing our next speaker, Maria English. So I'll just turn over to Don at this point. Thank you very much.
Oh, well, tēnā koutou, tēnā koutou, tēnā koutou katoa, and thank you, everybody. I'd like to acknowledge the mihi whakatau that Mana Whanua gave us this morning. It was always really interesting to hear about the history of our land and our place. Mick, thanks for the introduction. We've sponsored Govis quite a lot over time, and this year they said, as part of your sponsorship thing, you get to sponsor a speaker. Who would you like to sponsor? And the answer was a kind of a no-brainer. Maria English and ImpactLab, have been, they may not realise this, but the talk of the town for quite a wee while now. And to me, once we said that's what we'd like to do, the most daunting thing I faced was having to introduce Maria. Because what ImpactLab, and led by their CEO and founder, Maria, have achieved, and what to me, as Mick is kind of insinuating, seems a very short period of time, is pretty amazing. The way that they have enabled charities, government agencies, and by extension Aotearoa to easily access and analyze data in a way that makes what they do better and be more impactful is changing, I think, New Zealand. So, apologies, I've just lost my thread there. I was thinking about, what else to say about Maria. There's a lot in the write-up. Go and have a look at that. Go and have a look at their website, because what leaps out of you at the website is 3 words: do good better. And it feels to me like we're put on this place for a reason. And if that reason doesn't include, like right at the top, do good better, why on earth are we here? So, Maria, I'm really looking forward to hearing from you and hearing about ImpactLab and the work that you folks are doing. Thank you.
Tala whalawa, manuia le taiao, tēnā koutou katoa. Ko takatimu te maunga, ko oreti te awa, no muri hikua hau, ko English toku whānau, ko Maria toku ingoa. I'm Maria, and it's a real honour to be here, and thank you, Don, for those very kind words. I'm really excited and privileged to get to speak today about creating impact with administrative data. Just to give me a feel, how many in the room have worked or work with the IDI? Okay, and how many work with administrative data within an agency? Great, okay, so quite a lot of you. So I guess for those who don't, in a simple sense, administrative data is the data that organisations collect basically in the course of doing business or delivering the services that they deliver. And I was reflecting actually on Minister Collins sharing about the digital driver's licence work. I was actually, before ImpactLab, working at Boston Consulting Group in Australia, and was part of the team that helped the New South Wales government create the first digital driver's licence, I think maybe in the world, about 10 years ago. So the Aussies are ahead of us when it comes to some aspects of digital government, but when it comes to administrative data, and particularly actually using it, as Don said, to think about how we can improve services and integrating it across government and making it available to the community, New Zealand is right up there internationally. Obviously, in New Zealand, as some of you will know, there's a lot of great analysis happening right now, particularly within the IDI, the Integrated Data Infrastructure. from an academic standpoint to really understand, and expand human knowledge when it relates to people and government. What I want to talk about today is something is related but a bit different, which is how this administrative data can be used for practical decision-making purposes. In a context where officials need to make funding and policy decisions about quite complex issues with constrained resources, limited time, and in an environment that is constantly changing. And I've called the talk Creating Impact with Administrative Data rather than Assessing Impact. And that's because over the past 5 years at ImpactLab, we've seen that there's a really big opportunity for government to use the data it already holds about how, where, and to whom services are delivered to improve those services and ultimately improve people's lives. So that's the opportunity. Just before I get started, a little bit about ImpactLab. Our goal is really to help make investment work for communities so that people can live the lives that they choose. And we do that by connecting decision makers with data that they can trust, use, and learn from, particularly decision makers in the social sector. A lot of who we work with, as Don mentioned, are charities and frontline community organisations, but also government agencies and philanthropic investors. Over the past 5 years since we started, we've measured, I think, about $700 million of investment and estimated the long-term impact of that for over 800,000 New Zealanders. So over the course of doing that, we've used administrative data, we've seen it used, and I'm just excited to share some of our reflections. I just want to kind of kick off with the question of what actually is impact. If this is about creating impact through the use of data, what is impact? And I think the powerful idea at the heart of the New Zealand social sector is that every person has the right to form hopes and goals for their life and that of their family and to go after those. And I think that's probably what motivates a lot of people to work in the public sector rather than in other sectors. I was recently driving in Mangere near the airport and I saw a quote written on the back of a building and it said, "Live your life as an exclamation, not an explanation." Because I think it's all too easy for us to live our lives as explanations of the circumstances that we find ourselves in and the threads of the stories of those who came before us. And often those stories go back many generations. But what's remarkable is that every week at ImpactLab, in our work with charities, we see examples of people who are in the most challenging of circumstances, who are finding the courage to make positive change in their lives. Here are some real examples. And I want us to keep these in mind as we get into the data. So we heard about a young man with an engineering degree who's blind, who had applied for 49 jobs and never got a job interview, choosing to apply for his 50th job. We heard about a father with diabetes who can't physically stand up for more than a few minutes, choosing to sign up for a 12-week couch-based exercise program with the goal of being able to literally get up from the couch. And that program, if you're interested, is called From the Couch. We also heard about a woman with schizophrenia choosing to leave her house for the first time in a year to go to the community picnic organised by her housing provider. So these are people who are forming aspirations for their own lives and those of their families, and they're going after them. And that's something that some of our customers, particularly the iwi-based ones, describe as mana motuhake, the ability to chart your own path in life. But the ability to chart your own path in life, as many of you who've looked at this data will know, is not evenly distributed in New Zealand. So this is a picture that was part of the motivation for ImpactLab to get started, and it's a picture built from administrative data. It's called the Mason curve, and what it shows is it basically stacks up every person in the New Zealand population based on their lifetime usage of government services on a fiscally costed basis. So this is services like justice, welfare, education, health. And what you can see from the curve is in that dark blue, about 15% of us, or over 700,000 New Zealanders, use half of government services on a costed basis. And that's New Zealanders who are living in what the Productivity Commission recently described as persistent disadvantage. So standing between these people and their aspirations are poverty, social exclusion, and a lack of access to housing, healthcare, and other essentials. What we're seeing is that mainstream services often aren't able to build trust and adapt to meet people's unique and complex needs in that 15%. And that's often where community organisations, charities step in to support and work alongside government. If you want a great example of this, head down to the Downtown City Ministry in central Wellington, where they've actually got their MSD teams sitting in their community hub, giving people access to the housing register and the benefits that they need, but doing it right there on site in a way that really fits the needs of the homeless community of Wellington, rather than those people having to navigate a scary, difficult environment with security guards where they often get kicked out. So that's really the opportunity that we have, is the decisions we can make to support the most vulnerable 15%. Because in response to the need, the New Zealand government spends over $60 billion a year on social services to help improve people's lives. But for almost none of that money do we really know actually who it's reaching, how that's translating into experiences of support for people, or what long-term difference it's making to their lives. So this is where the data comes in. You can see the administrative data helps us understand the pattern of need, which can be remarkably predictable. But even more so, it can help us understand and build a better view of where our investment's going. Is it working for the communities we care about? And how do we do good better with our decision making, especially for those people in the dark blue who most need effective services? So at ImpactLab, we are trying to help organisations, and particularly frontline community organisations, to understand that where's the investment going, and is it making a difference? And to do that, we look at something called social value. So this is a kind of a conceptual picture of social value. So the idea here is that the dotted line is the pathway of a person or a family's life over time. And that pathway has ups and downs. And as I mentioned earlier, there's often an intergenerational story that starts before this person's life starts. And then at some point, this person comes into contact with a program or a service that might be offered by government or funded by government. And at that point, the opportunity is to shift in a more positive direction the pathway that person or family's life takes. And that sort of downward dotted line is sort of what we could predict might happen if this person doesn't get support. And then the upward line is how that might shift in a more positive direction. And we can think about that both in terms of negative outcomes avoided and positive outcomes achieved. So when we work with organisations, we use data to understand effectively the past, the present, and the future. The past being what has been the story of the people in this service, what are their needs, what are their goals. The present being what is the actual support provided in the program or service, and what kind of operational data is there to evidence that is happening. And then the future, and that's where it gets, as the data people here will know, a lot harder, because to some extent we can track actual outcomes, but often the real outcomes occur far after someone has left a service. And so that's where we have to basically build probabilistic predictive models using the best of the data that we have to conservatively estimate, for example, how likely is it that if a child can get out of a car into a warm, dry house, that their likelihood of ending up in hospital with a respiratory condition decreases. So social value is really the difference between what the pathway would look like without support and what the pathway could look like with support. And then once we've valued that, we compare that to the cost or the investment that goes into a service or program to calculate a social return on investment, which you might have seen in the newspapers, which says for every dollar that goes into the service, we can estimate $2 of value returned to New Zealand. So how do we actually measure it? That's probably the thing you're wondering. We do it by linking three kinds of existing information. I think existing information is a really important term here. we're not doing kind of new novel primary research. That's a really important and expert task. But what we're focused on is how do we use what we already know to build a view of the return on investment in a service. And we look at 3 kinds of knowledge in particular. The first one is the frontline experience and operational data from communities. And sorry, that's been cut off. But that's really information of 2 kinds. It's the stories of the people who use a service and the frontline teams delivering it. We've found that you can talk to the CEO of a provider about what they do, but actually the best person to talk to is the person manning the phones or the youth worker who's going out and meeting the young people, because they know what's really happening. And we can then pair that with the frontline operational data about things like how many people turned up, how long did they stay for, what do we know about the needs of those people. We then look at government administrative data. So this is data about a few things. It can help us understand what if a provider doesn't know much about their population, but they know some things. For example, they know we work with children who have intellectual disabilities. Then the administrative and public data can help us understand what are likely to be some of the experiences that population has, as well as, without support, what would we expect to happen? So, for example, we worked with a disability organisation in the employment space, and we could see from the IDI that if you're disabled and unemployed, in a 12-month period, your likelihood of getting a job is 4 times lower than if you're unemployed but not disabled. So we can use the government data to understand those pathways, as well as the fiscal costs, in an integrated manner. So if that guy who had 49 job applications, if he can get a job, what's the future impact likely to be, not just on his income, but also on his healthcare costs and his MSD costs? We can use the integrated government data to start to kind of probabilistically estimate what some of those real-world costs might look like. And then the final kind of data is academic evidence. And that's really to do the predictive work, to be able to say, you know, if a certain thing changes, what's the likelihood of downstream positive impacts? We basically review and have a big database of studies, and then we match those to the real service that we're looking at to find the closest matches in terms of population, outcomes, nature of the service. As you can imagine, there's some areas where there's studies to Africa that score a 5 on the Maryland scale, and they're great. There are other areas where there's almost no good quality academic research. So again, we use what's available, be conservative in our estimates, and then identify those gaps to be filled. So what does this actually look like in practice? So I want to just give 1 or 2 examples so you can get a feel for what the actual use of the data looks like. So the first one is in community housing. Now, this is actually one of my favourite pictures. It's one of the most striking sort of administrative data pictures I've seen in my time at ImpactLab so far. And it shows the experiences of a group of 120 people with serious mental health conditions interacting with the hospital system. So the data comes from the DHB about the hospital system interactions. On the left, you can see the before picture, which shows the number of nights that these people spent in hospital over a 1-year period. Each line represents a person's experience. So you can see with that grey line that on average, these people stayed in hospital for 122 nights in the year. So on average, they're living a third of the year in hospital. And for some people, it was as many as 300 or 350 nights. The after picture on the right shows what happened to hospital stays after people were moved into tailored long-term community housing with a specialist community housing provider. And you can see that the average nights in hospital decreased 92%, from 122 to 10, and it decreases significantly for everyone. And what you can't see here is that we looked at the next 5 years, and the numbers stayed low for the next 5 years. So that's a pretty phenomenal difference. And if you think of that social value picture, this is obviously just the tip of the iceberg, but you think about what's changing in people's experience when their nights in hospital jump from 122 to 10. we estimated that through housing, there's 120 people. The local, former DHB, was able to free up $4.9 million of hospital capacity. And when we accounted for predictions of other social benefits that connect to getting appropriate housing, things like reducing addiction, reducing offending, improving physical health, we estimated that the social return on investment for New Zealand of the service was around $4.50 per dollar invested. So I think, what's the point of this? What's the impact? Well, there's a couple of things. Firstly, the people delivering the service had never seen this information. They knew anecdotally that when people got their housing, they were healthier, that they weren't cycling in and out of hospital as much, that their tenancy managers were able to kind of identify when things were going, like people needed more support and get it to them. But they didn't actually know the real... the extent to which that change was happening. And that was just really important in terms of building the morale and confidence of that team and of the staff who work really hard in that service. The second impact is that the DHB has a contract with that provider that exists for the purpose of getting this outcome. So the point of the contract is that the DHB funds the connectivity to housing to reduce sort of pressure on the hospital capacity and get better outcomes for those people. And this data shows that that's happening. And what's great is that this data is data they already had. So it didn't require going out and originating more information. It didn't require taking more time from tenants, for whom time is often one of their most valuable resources. It meant they could just see and have confidence that that contract is doing the job that it was supposed to do. But it did require linking the data from the provider with the data from the DHB. This is another example, quite different, and it's phone support for people who are in financial hardship. So they call up a phone line that is offered by government, and then they can get help and directed to the right kind of support based on their financial situation. And that could be just getting information, it could be referrals to other services, it could be advice. You don't need to kind of, worry too much about the detail of this picture, but the important point is that we use the government administrative data to basically just track the cycle of engagement of people with this phone line, which seems like a really boring thing, right? Like it's just operational data, run-of-the-mill, no causal inference analysis, just simply what actually happened with people calling the line. But what was really interesting is that when we tracked through the stages people go through, from calling to getting hold of someone to then holding on long enough to have a conversation, what we realised is that of the 21,000 odd people that were engaged, 60% engaged meaningfully enough to get support. That meant that 39% of the people who on the sort of numbers were engaging actually weren't either getting hold of someone or staying long enough on the line to get meaningful support. When we segmented the people calling, we also realised that the lowest engagement rate was for people in known financial distress. So the people who most needed the service were least likely to be able to meaningfully get support from it. And so then the question is, well, why? And what we find is that the data just starts the conversation, it doesn't finish it. So when we started asking the frontline teams about the people in known distress, they told us that, it's really hard for those people to engage because when the call team calls them back, they get a mobile notification that says unknown number. They assume that that's a debt collection agency and they don't pick it up. So, quite a simple reason that the people for whom the service most exists are not getting supported by it. And so there were a couple of flow-ons from this in terms of how this information could practically be used. The first one is that the SROI modelling showed that a 10% increasement in engagement could equate to a 20% increase in estimated social value per dollar spent. So what that means is that this service could actually, through doing some simple things, if they could increase the level of engagement of people calling, they could create significantly more impact without actually spending more money, just by addressing some of the things about people's experience. And then they did exactly that. So the frontline team that we worked with instigated a few things. They reviewed, because they realised there were problems with the handover with creditors, which created the problem for people in known distress. So they reviewed that process. they did a lot of work around just clarifying how they work in their service to reduce accidental calls, because there were lots of people accidentally calling up, taking the team's time, which meant the people who needed it couldn't get hold of anyone. And also they started collecting time of call data because they had a hypothesis that they were missing a lot of calls, but weren't sure, is it we need more people on the team, or is it that we need to extend our opening hours? Like, what is going on there? They needed to collect more information. So again, I think it's sort of a simple but pretty powerful example of how sort of information that's already sitting in the administrative data can really help to meaningfully improve services for people who need them. So I guess, like, to sum up those two stories, the principle here is use to improve. What I've noticed is that often people don't get into to using the data because we know there are big issues with quality. We know that there's a lot of missing information, and we don't want to get things wrong. But what we've found is that the only way to improve the data is to use the data that you already have. And we see that we've worked with, I think, 250 different programs. We see that every time. It's not until you start to use what you have that you realise that the data is useful and it's worth investing in. And you realise which gaps are the critical ones that need to be filled. And often you realise you know more than you think you did. So just to, I guess, to close, I think one important thing is that there's a real opportunity to use these kinds of data tools at scale. Because I think we do some great work here in New Zealand around kind of what I describe as bespoke or deep dive analysis with a particular policy question where we go really deep on a segment of data to unpack that question. But where I think we could go is actually using tools that we can apply at scale across whole populations or whole service portfolios to get different kinds of insights. And ImpactLab is doing some work in this area. So on the left you can see a portfolio map we created using kind of our data about the social return on investment of all the providers that we've worked with, or 100 of them, the recent ones. And we basically just plotted out what's the social value per person of each of these services and what's the cost per person. And we got this really interesting pattern where we saw that some of the services were what we'd describe as broad impact, so low cost, high scale, modest social value. And then at the other end, we had these deep impact services, high cost, much smaller, so none of those programs served more than 500 people in a location, and much higher cost. And the point here is that it's not that one kind of service or one sort of SROI score is better than another. The point is that if you understand kind of where different services sit, then there are different implications for how you might think about decision making. So for example, for broad impact, scaling up those services is really important, but because they're light touch, you really want to think about where does someone go next. So if it's a financial literacy in schools program, kids gets a few weeks of education, but what happens next to continue that journey for them? Whereas at the deep impact end, you might be a program working with 10 guys who've been in prison for 5 years or more to reintegrate them into the community. That's my timer, I'm trying to keep to time. And you know, if you have 10 guys and 5 of them are getting through, it might be worth spending 40 grand to get the 6th one to make it all the way through the program. So it's just different trade-offs, different considerations, and that view of portfolio only comes if you can actually measure enough programs. And that's why we've put a lot of effort into standardized, scalable approaches to measurement that can complement the more deep dive analysis that you see from universities and things like that. So just to close, I think I just wanted to share 1 or 2 reflections on kind of use of administrative data for government, because obviously we're kind of adjacent, but we're not in the belly of the beast like you guys are. 3 reasons it's really useful, and you should strongly think about using it if you aren't already. 1, it already exists. And for the vast majority of social services, that fact in itself means we can know things that otherwise won't be known because there isn't resource or time to originate that data. Secondly, it can be integrated, and that's really important to get a holistic view of people's experience. So, for example, earlier you saw just integrating the hospital and the housing data gave us a much better insight into what's going on for people than if we could just see one or the other. And the third thing is it gives us, I think, often signals about real meaningful changes happening in people's lives. But we just got to be careful to know that it's just a signal, it's nothing more. So the fact someone's spending a third of their life in hospital tells us something. That's quite important, but it certainly doesn't tell us everything. But we also got to be mindful of, I guess, the limitations or how we approach the use of this data. What we've learned is you've got to spend a lot of time on the data definitions to, as much as possible, be really clear about what you're capturing, and you're probably going to get it wrong the first time, and that's okay. You've just got to keep iterating. The second thing is, obviously, the governance is something that really needs close attention, and I want to give a big thanks to Stats NZ, who've worked with us as a great partner around getting that right when it comes to sharing this data back to communities. And then the third thing is, it's only one view. And so what you'll see with these examples, when you can combine information and knowledge from different places, you get a much better and contextualized view of what's going on. And so if you're just looking at the administrative data, you just know that there's pieces of the puzzle that are missing. But what we're finding is you can get those other pieces, or a lot of them, if you reach out to communities. Every week we've got community organisations coming to us who want to have the insight that comes from being able to connect into the government data. But it's extremely difficult for them to do that. But if you can look across the fence and connect up between communities and government, then on both sides we get a much better view as decision makers of what we can do to help deliver effective services to people. So that's really it. So I just want to leave you with one question, which is, what decision can you or someone in your team or your organisation make that could improve lives? And what information could you help that decision maker connect with that could give them not perfect information, not the answer about what to do, but could help them know more than they do today about who they're reaching, how they can improve services for people, and what kind of change that could create in lives. Thank you.
We are running a smidge late, but I feel like that was so good and so interesting. I would hate to take you away from the audience and deny Don the opportunity to ask you a question. So I think we'll take one.
Are there questions on Slido?
I don't know. Yes, there are.
All right. So the first point made is a very impressive presentation. I'd like to thank you, Maria, for bringing such clarity and insight to a topic that could be really complex. And we're really lucky to have you. So thank you very much for that. So on Slido, shall we go Slido? Yeah, actually, before we do, I've got a question. I noticed part of your degree is in politics. And the question is, you have a lot of information that people can act on, but when that works against the sort of political drivers of the day, or maybe things politicians have been saying to get votes, how do you persuade ministers and so on to act?
I think what we've found is information changes the conversation, because it's very easy to have these conversations without information, and then you kind of are in an eternal loop, generally speaking. But once we've got some real information, like that graph of the hospital stays, people can then choose. I mean, either you need to sort of reject it, and that's good, because then we're in a discussion about how can we know what's really happening for those people, or you accept it, and then we've got some kind of third party, somewhat objective information that people on all sides can agree on. And so I think it shifts things forward. And so I think there's a real power in that. And also the other thing, like the sense I have, is sometimes once you know something, you can't unknow it. And so like that housing program only exists in 2 places in New Zealand, I think, Auckland and Christchurch. And that just begs the question, why doesn't it exist everywhere else? Or, Downtown Community Ministry, they provide dental services at their hub for people who are homeless and sleeping rough. And they mention that they're not aware of many other places in the country where if you're homeless, you can actually access a dental service. That's the thing, once we know these things, what do we do with that? I think that's the question for all sides.
Cool. Yeah. Remember somebody once telling me that Jerry Brownlee was persuaded to invest in cycle lanes in Christchurch because it was shown it would save him a lot of money. So there you go. Shall we pick one from here? I'd like to know that one about, have you ever analysed programs that you found were not delivering a good SROI?
Yeah, so I think, well, it's an interesting question. What is a good SROI? And we're just, I think, at the beginning of learning about that. For example, we're doing a lot of work in housing at the moment. And if you compare housing to a youth mentoring program, the cost outlays are just totally different. So what is good, I think, is a question of context. But we've certainly seen programs that have, we can't account for as many dollars of return as dollars put in. Sometimes that's to do with data limitations, quite often. And so that's a really good conversation with both providers and government to say, we need to collect better or more information. I think in the disability space, we run into that a lot. The public data around disability is just, it's not as good as we'd like it to be. And then there's definitely always room for improvement. So I think that's part of what, when we start working with organisations and funders, it's really important that at the start you know this is about learning. It's not just about ticking a box to say we're good. Because if you treat it as a learning process, you are going to find a lot of opportunities to improve. And we see that the organisations with less good results than they wanted often make the most actual change to their services as a result of this process. So in my view, they're the best organisations because they're the ones who are meaningfully improving people's experiences as a result of the process.
How are we doing? Wrap up? Yeah. No, I think, just to disagree with you, Mick, I think Minister Collins would have our skins if we didn't ask that last question, which was, how is AI going to...
Oh, yeah, no, that's the topic of the day. You're right.
Yeah, I mean, I think it goes with what I was saying before about scale, which is if we can sort of build the tools and the data connectivity to have this information at scale, then AI becomes extremely useful just as a way of saving all you guys time and being able to quickly make more sense of the information. And also qualitative information, so the natural language processing. I mean, the qualitative data is just such an important part of understanding impact. And we're just starting to see some pretty exciting tools emerging using AI to kind of summarize or make sense of things like, someone who's using a counselling service, being able to provide feedback over the phone and that turning into something.
Yeah. That's Mick's never going to invite me to MC a speaker again. Don't worry about that. Thank you very much, Maria. Use to improve was the other finishing thing.
Thank you.
Thank you very much.
Yeah.
This is for you.
Thank you so much.